You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, who's a candidate for mini dental implants? If you are missing teeth, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Larry Stroud. Dr. Stroud is the founder of Smile Studio at Valley Dental in Louisville, Kentucky. We've invited Dr. Stroud on the program today to discuss who's a candidate for mini dental implants. Dr. Stroud, welcome to the program.
Thanks, Randy. It's a pleasure to be here.
Mini implants. This seems to be your focus. I mean, you're the go-to guy in Louisville, I've been told, for mini implants. Is that right? I mean, has it become very popular?
It's become popular, and it's becoming even more popular, Randy. Through the years in my practice, I've seen people that have struggled so hard with their dentures, especially lower dentures. They can't wear them, they can't keep the things in, they can't eat, they rub, they hurt. People with partial plates, they don't like those unsightly clasps. And over the years, their only real good solution for that in the past was the traditional surgical implants.
Okay.
And that's a good option, that works, but a lot of people I've found really don't want to go through all the extensive surgery involved.
Is it a lot more surgery than a mini implant?
Yes, it is. It's a lot more traditional surgery. Typically, patients are put to sleep, and it's a big surgical process.
Do mini implants work, for the most part, as well as a regular dental implant?
Yes, the research and statistics we have, and based on my practice, about a 95% or so success rate. And yes, they definitely do work. We're doing it for a lot of people, and there are over 1,000 dentists that we know of right now that are doing these things across the country.
Yeah, I mean, our show airs nationwide, and we've talked about mini implants on the show, and it seems to be a very popular topic. People, I guess, get their teeth back. How long or how'd you get involved in mini implants? Why the big focus?
Well, I got involved with mini implants about 5 years ago. I had just seen some literature, been reading some literature about it. I never placed traditional implants, never really wanted to. It is a lot that the patients go through, and it just looked very interesting, these mini implants, because it looked like a way that patients could have this sort of thing done without having to go through so much.
And they are less expensive, I guess, than regular dental implants. Is that right?
Yeah, significant less cost than the traditional implants, and a lot less healing and recovery time. It goes very quickly with the mini implants.
So what are the different categories of patients? What type of patients are you seeing that are coming in for mini implants?
People that are missing one tooth, people that are wearing partials and hate those partials, and we can replace several of the teeth or all the teeth that are on their partial plate, even teeth in the front. People that are wearing dentures and they're uncomfortable and irritating and rub and sore. Even teenagers that are missing some front teeth that just do not form or do not develop.
So in the front, not a problem?
Right. Can be done in the front.
How old do you have to be to get a dental implant?
We have done these mini dental implants on patients from age 15 to 88.
How big of a problem is tooth loss?
Well, it's a big problem. I mean, there's probably over 40 million people that are that have lost their teeth.
That are wearing dentures, is that right?
That are wearing dentures, and that usually starts with losing one tooth.
Yeah, we talked on the phone, and one of the things you said is that if you got them early enough, that you could probably stop that snowball effect from happening. How so?
Well, if a person is missing one or two teeth, if they have those teeth replaced pretty soon and supports the other teeth, it will just help from the deterioration of the other teeth and maybe kind of stop the downhill process.
Okay, let's compare dental implants, and starting with the one tooth. How does what you do differ from what traditional dentistry would offer to fix that one tooth?
Well, in the past what we did, and we did this all the time too, if a person's missing a tooth, one tooth, to do a traditional type of bridge, you have to trim or grind down the teeth beside that to put a bridge in. With mini implants now, we can just put an implant in, put the tooth on it. The good teeth stay intact. You don't have to grind them down, and so it's just a lot less invasive and not destructive to the other teeth.
So the mini implant, by the way, for people that don't know what that is, I mean, what is it, a tooth root? I mean, it mimics a tooth root. What is it?
The mini implant is really looks like a long screw.
Okay.
It really just looks like a long screw. It's narrower than a traditional surgical implant, and it's much different in the way it's placed. It's not nearly as invasive type of process in the way it's placed. But it looks like a long screw. Whereas traditional implant, They actually do have to cut the gum open and more of a surgical process to place it. With the mini implant, all we have to do is kind of numb the top of the gum a little bit.
Is that right?
Make a little starter hole. The implant's actually screwed in. People really have no sensation when the implant
So they don't feel it.
placed.
It's not painful. That's not something they complain about.
No. People are always worried about it. They think it's going to hurt.
Right. It seems
They
like it
think
would
it's
hurt.
going to hurt. Even when I look at it, even when I show them the models, everybody thinks it's going to hurt.
Okay.
But then they're usually surprised when it doesn't.
What about age ranges? You say you have some 16-year-olds.
We've done this
How old?
for teenagers as young as 15 years old, and typically that's for the kind of cases where they're congenitally missing some teeth, where some permanent teeth just do not form, and then maybe after their braces are finished, they need to have those teeth replaced. And that's a very easy, non-invasive way to have some teeth that can stay in for these kids to wear. It works great for that. And then we've also done these for people up to the age of 88 to help them keep their lower denture in so they can eat.
Okay, so the person that would, because pops in my head, why would an 88-year-old want mini implants?
It can't eat. Lower denture won't stay in over the years. And this is what happens with dentures. When people wear dentures for years and years, it wears away the jawbone, it wears away the gum, the ridge, and it also wears away the jawbone. It's just kind of the natural process of the dentures moving and rubbing, and it just constantly, gradually wears away the gum and the bone, and then they end up with not much there, and the face gets kind of all wrinkled and scrunched up, and their chin gets closer to their nose. And
just because why? They're losing bone?
They're losing bone. They're losing bone.
So how does implants, though, mini implants, preserve the bone?
Well, really, any kind of implant.
It's just the pressure?
Any kind of implant, once it's placed in the bone, helps preserve that bone so the bone doesn't get worn away. Okay. Whether it's traditional surgical implants or mini implants. When you have implants in the bone, helps to hold that jawbone there so they don't get that loss and deterioration and change in their facial structure and prevent them from looking older than they really are.
Of all the areas of dentistry, because you do a lot of general dentistry as well, is the mini implant patient, do they seem to be the happiest group of patients?
Oh, Randy, since we started doing these mini implants, it's just been the most amazing thing, because this, more than anything that I've seen or done or been involved with in practices, has been the most satisfying, because it really changes people's lives.
How so? You say it changes somebody's life.
Well, let me talk about this one particular girl,
okay.
Lawana Medley. She came to me. She was very quiet, soft-spoken. She talked to me like this. She didn't want me to hardly see her. She was very embarrassed. She had been without teeth at all. She had no teeth for years. And she had a horrible gagging problem. She had tried to wear teeth in the past, but couldn't wear any teeth.
Couldn't do it.
Just couldn't tolerate any teeth in her mouth. So she came to me for the mini implants, and we made her some new teeth, made her new dentures, and attached them with the mini implants. And now she's going out in public, going out and eating, just tickled to death, smiling all the time.
So they snap in, snap out, or they're fixed?
Snap in. She has dentures that are snapped in place. But the key for her was that she can now wear her teeth, because when they're attached with the mini implants, we can cut a lot of that dental plate away. We cut all that plate out of the palate, and that's what gags people so bad and drives them crazy.
Interesting.
So we're able to cut a lot of that plate away so they don't have all that in there. And so she's gone from this, quiet, shy person that would never even go out in public to just going out and enjoying life and smiling big.
So it's a boost in self-esteem.
Having a good time, yeah.
Okay. What about people missing just 3 or 4 teeth? Is that a great candidate?
Yeah, it works just as well, Randy. We do that a lot of times for people. Typically, people may be wearing partial plates. And
what's a partial plate?
Well, a partial plate, people are familiar with that. It replaces several of the teeth, anywhere from 1 to several of the teeth. It can be front teeth or back teeth. It typically has a metal base, and it kind of has those wire hooks that hooks around the teeth, and those are the things that people don't like because they're kind of unsightly, and they can kind of damage the teeth. So anyway, one of the biggest things we do with these mini implants is replace these partial plates, because what we can do is put the teeth in there to stay. Again, we don't have to cut the other good teeth down or damage the other good teeth, but we can just put the teeth in to stay, really just in 2